Now trachoma को grade करने के लिए कितने follicles? Very difficult question. 5 or more follicles in the upper tarsal conjunctiva. Mayer's loop is what? Superior or inferior? Then what is inferior because of? Mayer's loop is temporal lobe, doctor. If it is lesion, superior quadrant anopsia. Parietal lobe mein what you have is Baum's loop, and the lesion of it is typically inferior quadrant anopia. That's what you need to ultimately remember. And superior quadrant anopia is also called pie in the sky. Appearance is what need to be remembered. What is meant by Schoffer's sign? Schoffer's sign. Do you see it looking at the patient's face, drilling into the patient's eye, or peeping into the patient's eye? Slit lamp, fundoscope, or visual? What is the Schoffer's sign? Without that only you might have answered it correctly, I know. Because they prepare for entrance like roadside tire repair shop, na? Chotu, depending on the voice sound, he will decide which screwdriver to be brought. The chotu in the this thing. If he says chotu, then he will bring a smaller screwdriver. Like that for entrance also, Schoffer means yeah, there is nothing else. Straight away retinal detachment ka answer lagao. Kind of a thing. That's called as roadside tire repair preparation, shop preparation style. So retinal detachment, it's correct only, there is nothing wrong about it. Schoffer's sign is the pigment behind the lens. If you do a slit lamp exam, in the cases of retinal detachment is what you are going to ultimately remember. Now, this is a proper full, what you call, South Indian vegetable thali kind of a question. If you answered it means there is no need of thinking. Diploma ophthalmology ko chhod do. MS ophthalmology mein second year mein direct admission de sakte. What was your answer? Have you heard of Bilchowski's 3-step evaluation of strabismus? You have not heard, no? Very simple. Obliques, recti, 2 groups of muscles, hai na? So remember 3 important rules, doctor. First, check whether the person is having hypertropia. If it is there, that is vertical misalignment of the eyes. If it is there, then there is a paralysis of one of the obliques, either superior or inferior oblique. Check left or right gaze. In which situation hypertrophia is greater? If the hypertropia is greater, if it is due to superior oblique, it will be greater on the gaze of the contralateral side. अगर राइट सुपीरियर ऑब्लिक चले गए तो लेफ्ट साइड को देखे तो वर्टिकल मिसअलाइनमेंट बिकम वर्सन. Then head tilt. Which side if you do will the hypertrophy worsens? If the hypertrophy is due to superior oblique, it will be greater in a head tilt to the ipsilateral side. Okay? So if you do these 3 steps methodically, you can discover whether it is superior oblique or inferior oblique, left or right. So typically, if you take the patient who has got inferior oblique, all these features basically are in concert. I leave the literature for you to review. Then the ultimate answer will come down to right inferior oblique based on the type of tilting which worsened and etc. etc. Now, if you take inferior oblique, the head typically is inclined towards the opposite side if it is superior oblique. It is towards the paradic side with the involvement of the inferior oblique. The other rules are all written over there. So if it is a right inferior oblique palsy, if you do this 3-step test, what will you typically come across? A right hypertrophia that is worse in the left gaze and when the head is tilted towards the left side, which exactly happened in the case study given to you. So let's go to the next question. The first statement is in incohesion with the second part of the statement. I too felt that, because the boy is walking into the room with the left sided head tilt, and on correcting that, it's more on the left side hypertrophia is towards superior oblique. Second part of the statement is towards the inferior oblique. Maybe while framing the question, there was hyper enthusiasm to come up with a solid question in ophthalmology. So that made the first part incoherent with the second. Yes. I thought, see, generally a teacher should be able to explain. Second, he should be able to convince. Third, he should be able to confuse. I thought if I do the third thing, you will leave me. But you are all brilliant students, going to be toppers, no? Hence you recognize first and second parts of the sentence are incoherent. Good. So, because we only, while going through this literature, I felt it should be superior oblique. But second part is in cohesion. I thought, chalo, first part ko chhod do or come to answer. It is given by top doins in ophthalmology, no? The question was given by. So we will bargain for a correct frame of the question. Now, short posterior ciliary, how many are there? You need to calculate in exam hall. It need to be 20. In exam hall, you will find some people thinking into sky, some people in a catatonic state, some will be watching towards the eye of the examiner. So that examiner will be wondering, why he is doing that? I am supposed to stare into him, he is staring into me. Because he is calculating posterior ciliary arteries. So you need to be sure. What is Leber theory? Leber theory is fundamentally about aqueous formation. White line of Guéneri. This is a complete Scotland exam. No Indian names. Venkatraman, Ramakrishnan, medium, nothing is there, no. So occipital cortex. This is a good question, excellent question. Wernicke's hemianopic pupillary reaction. This you need to be quite sure. Yes. Question number 149. What level may you get hemianopic pupil? Suppose if you have a lesion in the chiasma or tract? Tract. Okay. That is one half reacts, other half doesn't. Kind of a pupil. Strums conoides. Curvature emetropia. Then which disorders in this are anxiety disorders basically, where you can be able to give the therapy, right? Antidepressants. You can give it in bulimia, OCD and panic, right? Not in delusional disorders. Antidepressants have no role. Was it antidepressant, anti-anxiety, which is much more relevant? Probably anti-anxiety, I thought. I didn't get time to actually review the literature. Okay. 41-year-old threatened to commit suicide. She agitated and emotionally labile. Now she is no longer suicidal. Her husband is having that tendency now. And what is the most important risk factor for completing a suicide? Very good. Psychotics, schizophrenia. If they think of suiciding, they will definitely prove it. Others will only threaten it. Or delusional guys may think they are suiciding, but actually they are eating biryani. So, delusional guys. So, now coming to the treatment of OCD. Obsessive-compulsive disorder is fundamentally what? the spectrum of the fluoxetine, clomipramine, behavioral therapy, not electroconvulsive therapy. It is not, it's a milder thing. So Schneider's first rank criteria, this all of you know very well. Somatic passivity, running commentary, thought withdrawal, suddenly exam you are thinking B, somebody is telling in your ears that it is answer C. So they are all first rank. Then acute mania mein what do you use? Lithium. Then secondary PPH commonly due to retained placental bits which you have left because without finishing job you went for solving few MCQ bits for entrance and left the laboring woman like that, so that retained placental bits are now leading to development of PPH. Now yes, till here I could get the time to prepare, doctor. Remaining questions you know better than me the answers because I didn't prepare. So thanks for coming down today evening, and tomorrow we have our regular test, mock test in the afternoon and discussion in the evening. Then next Sunday we will have the Karnataka paper. After that the next Sunday we have the state entrance. So time is short. Time is short, art is long with the opportunity splitting. Come on, kick up and then read the remaining time. Thank you.